Hello everyone, here with me is Geoffrey from UK. He's an osteopath and ANF instructor. Welcome to the ANF Academy.
It's a pleasure to be here. We've been invited to come into the instructor training to really perfect the aspect of how we're going to teach ANF Therapy Method to students.
Feel being back here?
It's great to come back because we have a sort of a family environment here, and
I need to stop you there because everyone are saying like this is like a family, but I want to know why.
Okay, to come back and be here with the developers of the technology and actually take the education to the next level, where we can be so clinically specific with our palpation and really understanding not just as students, because there's a real challenge with ANF.
And Dr. Mikhail.
Right, and you know, if you've got experience as a clinician and you think you know what you need to know, you come here and you realise very quickly that there's a lot more to learn. And Dr. Mikhail is very demanding of you. I mean, he will challenge you and he'll take you to your absolute limit. And I think for those people that want to be at the very best for their practice, this is a really good environment for them to come into.
So you believe in continuous education?
100%. If we're not growing and expanding, and if we're not refining our skills constantly, then we can't provide the best service for our patients.
Yeah, that's true.
So,
what made you join ANF and what kind of expectations you had at that point?
well, for me it was serendipity, because I was in Dubai and with a colleague who has really progressed very well with ANF. And back in the early days, I flew in on the red-eye flight, and we were going to have a full clinic that day. And she said, "Jeff, you look terrible," you know, and she put these mental focus discs on my optic nerve, and I thought I was fine, and I would have got on and done the day in my usual way, but I really felt a very significant shift in my ability to concentrate that day. My focus was, it was incredible, and then I said, I understand frequency medicine.
So that was your first experience?
That was my first experience, where she basically just insisted that I would wear these devices. And then, of course, because this is somebody that I love and trust, we work very closely together, I had to understand more about what was going on. We work with frequency medicine anyway in our clinic, and we've got a long history of working with sound frequencies and EAV testing and bioresonance. And the interesting factor around the way I came into ANF is that my family lived very close here in Spain, and I was visiting. Renata was here studying with Dr. Hoff, and she said, "Where are you in Spain?" And I said, "Well, where are you?" She said, "I'm in Marbella." I said, "That's half an hour away."
Yeah.
So I came and had a coffee with Dr. Mikhail, and we talked. What was going to be a 10-minute coffee turned into 2.5 hours of talking about frequencies.
Yeah, usually it goes like that.
And that's why I'm here.
Yeah, excellent. But what made you become an ANF instructor?
Well, the natural progression from, as a student, you realise there's a lot more to learn. You take the knowledge that you've acquired here back to your clinic. You see fast, tangible, demonstrable results. The patients then start to get interested and they send their friends, and then you start to work with the protocols and the ANF Therapy Method. And when you apply the devices and you see that rapid change in the physiology of the human body, if you're a thinking practitioner, you're going to want to find out more. So then you come and get the next education, and then the next one.
Questions.
And then I suspect that the instructors can see who is the right kind of candidate to then invite them to take the teacher training modules, which is what I did.
What did you learn here that no other therapy or tool show you?
When I went through osteopathic school, 4-year degree course in osteopathic medicine, we had a very good foundation in anatomy, and we did dissection with a very few people get to do that. Anatomy, physiology, we had a very, very good education in systems medicine, and then obviously the practical application of that knowledge into the human body from the standpoint of osteopathic medicine. They didn't teach me to palpate properly. They didn't teach me to find a nerve. and to track the nerve, and they didn't teach me to consider that there might be silent inflammation in the nervous system where the patient doesn't actually even realise that deep down inside of their tissues they're on fire. You could find trigger points and you'd think, oh, that's an interesting inflamed area, and we'll just work on that. You know, we'll use our mechanical techniques, our massage and our manipulative adjustments and the cranial work to get the flow back into the human body, to remove the obstacles to cure. But what we're talking about here is clinically specific assessment of the patient, where you're learning to palpate in a way that even at the best training school in the world for osteopathy, they didn't teach me that. So we're doing surgery without knives as osteopaths anyway, but this is taking it to the whole next level, and to be able to track things back so that you can get to the level of causation and then intervene with a therapy, with a device that has immediate results.
How a healthcare practitioner can recognize silent inflammation? How would you explain what it is and what's causing it?
You know, look, the thing is, patients are coming into the clinic and they're saying, I'm tired, my guts don't work, my muscles ache, I get up in the morning, I don't feel...
We think it's normal because we wake up like that every single day, right?
As a human race right now, certainly in the first world, you could say, you know, in that sense, most people are walking around in a suboptimal state, and they don't even know that's happening. So they're coming into the clinics with their ailments. You know, I've got a pain in my shoulder, but then when you question them, they've also got gut problems because the liver and the shoulder are connected. So they think they've got a shoulder problem, but it's more than that. So we have now polysystemic illnesses, and from the musculoskeletal perspective, you could say that's the warning sign that something's not right. So that might not be silent inflammation, because it could be a frozen shoulder that's massively inflamed. So it's very visible inflammation in terms of pain and restriction of movement, but it's a sign that there's trouble in the body. You know, it's not just always as a result of an injury. You know, we might have had the injury 10 years ago, and the damage was done where it kind of caused the problem, and it's only many years later that you see the full effects of the injury, because the body hasn't been able to clear it properly. There was a blockage to the full healing process.
But what's causing silent inflammation?
Poor dietary choices, lifestyle to a certain extent, because the oxidative stress that's present, we have a situation where we're being bombarded with different stressors on the body, and the oxidative stress in the body and the free radicals that come about because of that oxidative stress is causing damage to the physiology of the body and the anatomy. The structure is affected because we don't have the resources to stay well. So
it's silent inflammation can be in your body for many, many years before you can see any kind of symptoms.
Yes, and it can come about because of an emotional shock. It's not just even that you'd had a fall or a car crash. There can be, these processes can occur because of what's going on in our emotional, you know, we could have had a bereavement, and we could end up in a situation where there's trouble in the body because we never processed the loss of a loved one. So it gets very, very interesting, and if you can't assess the patient completely to understand what's at work, and as I say, my whole thing is that the human body, the tendency to be well is ever present. We're always looking to be perfect. The body's always going to repair itself. If you cut yourself, you look back a few weeks later and it should be healed. And if healing doesn't occur in the body, it's because there's an obstacle to cure. And prior to ANF, we would look for the obstacles in the energy field close to the body, or we would look for the obstacle in the structure of the body, and we would look to promote blood flow. We would look to provide resources from the standpoint of really good nutrition and hydration, and telling people how to live well, have fun in life, not be too kind of, you know, because people can take it to an extreme, right? But the thing is, now, if the obstacle to cure isn't fully removed, you won't get complete healing. The body will compensate and there'll be a compensatory adjustment, and the body will reach a point where if healing needs to happen, it'll be put on the back burner because the resources that are needed to do the healing in that area can't be utilised there forever. So the body says, oh, I'm just going to ignore that problem area and I'm going to use the resources for other things. So that's how we end up with a chronic problem with inflammation and damage that just progresses very insidiously. It's really interesting.
If we don't locate and address the root cause, all the symptoms we have will reappear.
They will reappear, and you might not even have symptoms, you might not even know that these degenerative processes are going on in the body until you get the full collapse.
Is it too late then, or it's not time?
I think
depends on the case.
Yes, exactly. And I think there's always hope, and this is where you do need to find yourself in the hands of a practitioner that understands what to do.
I'm asking that because I suppose that many that will be watching this video will be stressing out, like silent inflammation, maybe I have it, is it too late, can I be healed, so...
Yeah, no, there's always hope. If you make the right lifestyle choices, first of all, so you have a responsibility as a human being to make sure that you're not destroying yourself with the choices that you make on a day-to-day basis. You need to make sure that as much as possible you're spiritually content and emotionally in a good place, because that's massive, and I mean, how many people are going to jobs that they hate? They get in the car every morning, they're tired, they go and work a job that they hate, they sit with people that they really don't get on very well with, and then they come home and they open a bottle of wine and switch the television on and they hypnotise themselves with the TV, and then they go to sleep, and then they do the same thing the next day.
Can you tell me about a case scenario that took you long time to obtain desired results, but with ANF, you could do it much faster?
Look, we're an osteopathic clinic, and patients come in often with low back pain and sciatic issues. Some of those can go very, very deep, where you've got disc herniation, you've got massive inflammation. Whether it's acute or chronic, there are significant factors at work. There may be pain radiating down into the leg because the nerves are affected. It's very, very obvious to the patient when that's happening. We see a lot of patients with a lot of inflammation over the pelvis and in the lower back, and it's very easy to palpate for that. And using the ANF Therapy Method, when you apply the devices onto patients that have that kind of pain syndrome, whether it's acute or chronic, you can immediately get results where they'll see increased ability to move pain-free, or the palpation aspect. I mean, it's amazing when you lie the patient down and you palpate properly and you get into the nerves and you find the nerves that are really angry and inflamed, where there's a fire going on in the nervous system, and you place the therapy devices. That patient knows exactly how painful it was when you pressed in there the first time. And when you press in there the next time, after the disc has had a chance to work, they drink a little bit of water, we leave a few minutes, and if it's not seconds, it's minutes. And then you press back in there and you say, how does that feel now? Because we expect 50% or more improvement. I mean, that's at the minimum, because if you don't have that, then you've got the wrong therapy device where you can get to the root cause. Often the patient at that point will then say, you're not pressing as hard as you did before. And then you really lean into it to show them, and they feel the pressure but no pain. So yes, for us, if we're working with pain patterns in and around the lower back, that would be probably the second most useful aspect for us in terms of a condition, if we were going to just work with the diet. But first one, frozen shoulder, hands down.
How many treatment sessions it takes to really pain?
It depends. I mean, someone might have cut the grass and ripped the tissue in the back because they started the lawnmower badly. Other times, the back problem has come on really slowly. It just depends. So it's impossible to say how many sessions, but what you can say is that we get really good results. Without ANF, we're a busy clinic. We get great results, and we've never done any marketing. Everyone comes word of mouth. And I was actually really happy with my results until chance showed me that ANF existed, until I came and sat with Dr. McCall and spoke with him and understood immediately that he was a master in understanding frequencies and how they affect the human body. I was very happy, with the result. I didn't know there was more, and I didn't know there was this possibility to instantly affect the living tissues and the nerves particularly, and start to take control of the human nervous system and take control of how the resources for healing can be directed into an area, how you can work with the blood flow and the lymphatic components. I had no idea there was that possibility. Even though we have all sorts of other modalities that have that effect, this just is quite unique, the way, if you understand on the continuum of the medical model, it takes a very, very big central space. That's my understanding of it now. I still think we need to do the other things, but ANF has a very, very big role in the future of doing medicine without drugs and doing surgery without knives.
How do your patients usually react on ANF?
The first thing that happens if they don't know what ANF is, when you start to explain it, they're skeptical, always.
It's natural.
Yeah. And that surprises me, because they already, if they're coming to me, we use tuning forks and we use all sorts of, so I mean, we're kind of out there.
But we are used to machines, but we are not used to something that small and powerful.
Yeah, so there's that skeptical aspect initially, and then when you evaluate correctly and they can feel the pain, and you have to tell them that it's going to hurt, because you're going to try and identify exactly where the problem is. Once you've identified how you're going to place the ANF device to interrupt the inflammation if it's there, and start to, for the signals to start to come back to normal, once they've understood that you're being very specific with how you're going to use the discs, and when you demonstrate the before and after pain, or they can move...
You mean when you place it and then when you remove it?
No, when you place it and then you palpate, and if you go back into that nerve that was very painful, or the tissue that was very painful, and they feel a massive change, which is more or less instant, or they might be able to move, in the case of the shoulder, they might suddenly have much more movement without pain. The reaction that you have in the patient is one of surprise. And then when they go away for a few days and they start to realise that they're healing, then comes the belief. And then the friends start coming, because they're sitting with their friends saying, I had this terrible problem, and I went there and they used these ANF frequency devices and I'm better. So we've been working principally with the minor orthopaedic issues to get to a point where we had mastery of what to do in those sort of situations, but there's so much more scope for working with integrated medicine, where you're looking at systems medicine in terms of how you can interrupt that silent inflammation, reset it back to normal, and provide resources for healing. And that's what I'm most excited about, because my patients come to me with polysystemic problems. We're seeing the really deep stuff, the autoimmune problems. We're a little bit like the last chance saloon, because these patients typically have been everywhere.
They tried everything.
They've tried everything. They've sometimes wasted a lot of money on things that were never going to work, but they're just desperate for healing. And we were getting great results with those patients anyway, but to discover ANF and to see how it fits in so beautifully into that existing model that we had, it's changing everything.
What would you say to those that never heard of ANF therapy, or they didn't start their education yet? They heard of
practitioners?
Yes. Okay.
I would say you're in for a really, really interesting ride. If you don't know about ANF, as I didn't, if you haven't seen the possibilities that come through ANF, you need to at least check it out to see where it could fit into your practice, because we're all different, and I just said, we don't do sports, but some practitioners, all they do is sports, and there's a huge place for ANF therapy in that field. So whatever you're doing as a practitioner right now, ANF can only enhance what you're doing. it will seamlessly fit into what you're doing once you understand the principles, and you are going to get shaken up so badly as it relates to your understanding of the human body, palpating the human body, assessing where the trouble is, identifying the root cause of where the trouble is, and then fixing it forever, if that's the bag that you're into, if that's what you want, if you want excellence and you want to be, look, you are going to, if you come and study this therapy and you apply the therapy alongside whatever else you're doing, you will excel in your medicine, and you will never have a lack of patience, because you can't stop word getting out in your community where you are. And if you want to lift yourself above the other practitioners doing their flat world medicine, then this is for you.
Thank you, Jeff.